Welcome to Healthbeat, the show that takes the pulse of South Africa's healthcare system. I'm Mia Malan. Elon Musk says he uses a small amount every other week for depression. Actor Matthew Perry died because he took too much.
Today we announced charges brought against 5 individuals who together are responsible for the death of Matthew Perry. Each of the defendants played a key role in his death. They falsely prescribed, sold, or injected the ketamine that caused Matthew Perry's tragic death. In the United States, most forms of ketamine are only approved by the Food and Drug Administration for anesthesia. A nasal spray version is approved for treatment of depression, but only in a certified medical setting. Here, Matthew Perry sought treatment for depression and anxiety and went to a local clinic where he became addicted to intravenous ketamine. When clinic doctors refused to increase his dosage, he turned to unscrupulous doctors who saw Perry as a way to make quick money.
Online, ketamine is often marketed as a miracle fix for the treatment of depression, anxiety, bipolar disorder, and even migraines. But in South Africa, it's not registered to treat any of these. Today on Healthbeat, we investigate the ketamine craze. Some clinics are cutting corners, offering ketamine treatment without proper diagnosis, using unproven methods and operating without medical supervision. The South African Society of Psychiatrists, SASOP, says ketamine should only be prescribed by specialists. Bhavi Vaithalingam from SASOP helped write the guidelines. Bhavi, thanks for your time. Why are psychiatrists talking about ketamine right now?
It's probably the first completely novel antidepressant that we've had for a long time. It works on glutamate, and none of our other antidepressants work on glutamate. But more importantly, it's very rapid acting. So with antidepressants, it usually takes about, say, 2 to 3 weeks for it to work with the traditional antidepressants. With ketamine, you can get a response within 2 to 3 days. And sometimes as we give the infusion, patients feel better.
Why does it work so fast?
We're not 100% sure, but we think that it's because it's working on the glutamate receptor and causes changes in the glutamate receptor and causes really very big neurodevelopmental changes very rapidly, and that's what gives you that really rapid onset of action.
What is a glutamate receptor?
So glutamate is a brain neurotransmitter. Like, people have heard of serotonin and noradrenaline. We have glutamate, which is another neurotransmitter, and it's situated throughout the brain, and ketamine works on that receptor.
So it's something that helps you to feel good.
If you're taking ketamine, for example, for drug use, it would produce an altered state of consciousness, which can make you feel good, but can also be unpleasant. But certainly for depression, it seems to work in a lot of people.
So who gets ketamine? Is it people who need to be helped immediately and then you wean them off it? If you say the effect also, weans off after some time, or how does it work?
So there are really 2 groups of people who would get ketamine. People who are extremely depressed, extremely suicidal, very distressed, in danger to themselves, where we need a very rapid onset of action. And the second group of people are what we call treatment resistant, where they have failed what we call an adequate trial. So that's a trial at a high enough dose for a long enough period of time of 2 standard antidepressants. And those people are people who could be considered for ketamine treatment.
And if you then put such a patient on ketamine, explain to us what happens.
So most people who have ketamine will have what we call a non-ordinary state of consciousness, where they may feel they are not in their body, which is what we call dissociation. They may see colors, they may see shapes, but some people get a proper psychedelic experience where they see things as they are not. They may experience reality in different ways. They may see complex shapes and colors. They may feel sounds as being colors. It can be a beautiful experience, but it can also be an anxiety-provoking experience.
And for how long would that last?
for as long as we give the infusion, so usually about 40 minutes.
Then they go home and they come back after how long?
2 to 3 days.
And they come, you said, for how many infusions do they come?
We do 6. We do 6 infusions.
And what happens after that?
There's no internationally recognized standard of maintenance. We're still trying to understand how we should do it. But there are definitely some people who get very well on ketamine and don't get well on other stuff. And for them, we need to top up. So initially, we would top up every week to 2 weeks for about 4 weeks and then reassess. There are some people who need monthly ketamine, but that we do with caution, and we do a constant reassessment of a patient to see, do we still need to give ketamine?
Now, what about addiction?
The first thing is to be very careful in selecting the right patient for ketamine. We have to assess somebody very carefully for previous substance use and for current substance use. So if somebody is an active substance user, even if they're not using ketamine, say they're an alcoholic, you'd be very cautious about giving ketamine.
Now, who can give ketamine? We have heard of many clinics that give it where it's not psychiatrists giving it, where it's a GP who gets many patients and give them infusions. Is that legal?
It is technically not illegal because any doctor can really give any medication. That's an HPCSA regulation, but you have to be within the scope of your practice, which means you have to be able to prescribe and you have to be able to manage the complications. The Society of Psychiatrists' recommendation and position is that only psychiatrists can prescribe ketamine because it is for either emergencies or treatment-resistant situations. But we follow the principles of the Society of Anesthesiologists in that people who must have an anesthetic qualification. So I, as a psychiatrist, will prescribe, but I don't actually give ketamine. My anesthetic colleagues are the people who give the ketamine.
Why anesthetics?
Ketamine is actually an anesthetic drug. It was developed for anesthetic purposes. And it was when depression started getting better on ketamine, that psychiatrists became interested in it.
Now for the big question, what does ketamine treatment cost, and do medical aids pay for it?
You're looking at about 2,400 to 2,500 per infusion. And the big cost of that is around personnel, because you need an anesthetically trained doctor and you need a nurse. And that's what your costs are really around. Do medical aids pay? Medical aids are starting to pay. So your top tier medical aids will pay for ketamine upon motivation. But the medical aids are really reluctant to pay, and a big cause of the reluctance is all these so-called cowboy ketamine clinics. The medical aids are saying quite rightly, we don't know if ketamine is going to be given safely.
Bobby, thanks so much for your time today.
Thank you for having me.
After the break,
you see stories about kids mixing it into fizzy drink bottles and taking them to parties, and then they get a high. That's really dangerous.
You're watching Healthbeat. On the streets, ketamine is known as Special K. In medical rooms, it's been used to put people to sleep for surgery. And at Tygerberg Hospital, it's also used to treat pain.
Ketamine's story began in the 1950s when scientists sought safer ways to provide sedation and pain relief. Its predecessor, PCP, caused harmful side effects and is now banned worldwide. Ketamine became a legal, registered anesthetic used around the world and is especially important in places with under-resourced hospitals. Ketamine was a breakthrough just in time for the Vietnam War.
Ketamine is one of the drugs that actually has one of the least effects on that cardiovascular system. So your blood pressure does not fall as much, your heart rate does not fall as much, your breathing is not as affected as much. In a war zone, you still need to be able to do a laparotomy or reset a broken bone. Ketamine gives you the option of having an anesthetic, providing pain relief to patients, but doing it in a way that is safer to do in resource-poor environments. So it is a very good anesthetic and it's a safe anesthetic.
From the 1990s, studies began showing that ketamine relieved depression. It's believed to work by blocking certain signals in the brain that affect mood and certain functions. At lower doses, ketamine seems to reset some pathways in the brain. Some people feel better faster than with regular antidepressants, which can take weeks to work. Today, ketamine is making a comeback in wealthier countries as a treatment for depression and trauma. It even comes in a nasal spray. But because of its feel-good properties, ketamine can be abused.
Some of the side effects that you can get is that it can give you hallucinations and it can give you vivid dreams.
In South Africa, it's a Schedule 5 drug, which means controls are tight.
If I were to walk into theatre now, I don't have access to it. The nurse has to go and unlock it from a cupboard and bring it to me, who will then observe how many mils I'm taking out of the vial, and I then have to sign in a register that I've given this patient.
For how ketamine fits into our health system, we're meeting Sean Chetty, Professor of Anesthesiology at Stellenbosch University and also President of the South African Society of Anesthesiologists. How widely is ketamine used for anesthetics today?
If you go into war zones in Sudan or in war zones in Europe for that matter, ketamine is widely used because it's a safe drug. The other thing, or the advantage of ketamine as an anesthetic agent, it's one of the few agents that actually also gives pain relief.
You at Tygerberg have a program that uses ketamine for pain management. Tell us about that.
So primarily we would use ketamine in chronic pain to do what we call, in layman's term, reset the opioid receptors. So normally if you take opioids over a long period of time, those receptors start getting a little bit used to it and they need more to give you the same effect. So obviously with things like opioids, we can't just keep going up and up because they come with side effects. And so one of the things that we can do and we can offer patients is to run a ketamine infusion to actually try and reset those receptors. And if that receptor resets, what it can do is it can bring your opioid requirements right down again. And so it's one of the options that we have in chronic pain management units. This is not something that a general practitioner manages. This is not something that a patient manages on their own. This is very specialist work, and you have to actually work with someone who is, I can't say a pain specialist because we don't have a registration for pain specialists in South Africa, but someone who is a specialist and very experienced in working in the field of pain medicine.
So if you give a patient ketamine, how long would that infusion, how long would the effect of it last?
So it's not permanent. What will happen is your receptors will reset, but then you'll be on the medication and they'll start getting used to it again. So let's say 6 months to a year, and then we'd probably have to actually redo it. So it's not a permanent fix, but it actually helps us manage chronic pain patients better.
If you're a GP and you've got a patient with chronic pain, you've tried everything, not working, you are not qualified to prescribe ketamine for that patient.
So it's very difficult within the scope of practice in South Africa for me to say that a GP cannot prescribe something, because within the scope of practice in South Africa, a GP can. Whether they should is a different story. So I don't have a problem with increasing education and training for healthcare workers in this country so that we can get healthcare to more people. But it must be done responsibly. So if, for example, you're the only GP in an area that's in the middle of nowhere and you want to do this, then come and you can get trained how to do this. Is there a formal qualification? No. Does that put patients at risk? Because how do I know? You can come to me as a GP and I can go, I can do this for you. How do I know that you can?
How many programs like yours are there in South Africa that use ketamine for chronic pain management?
In the Western Cape, there are 2, KwaZulu-Natal 1, in Gauteng there's 1, and in the Free State there's 1. Those are the academic hospitals. In the private sector, pain is not regulated. So people may be administering ketamine, but there's nothing that regulates how they're doing it. That's our challenge, right? Because how does the patient know who they can go to and who they can't?
Does that concern you?
It concerns me a lot, because ultimately as a doctor and as a specialist, as an academic, I want us to be able to provide safe care for patients. And safety comes with training and comes with education. And if we're not doing that, then I think we're being irresponsible.
If you look internationally and you compare South Africa to how ketamine is used in countries like, say, the United States and in Europe, how do we compare?
So our approach in the mainstream medical environment is conservative and is pretty well controlled because of the risks of illicit use. But there is an illicit market. And how people are getting the illicit drug, I don't know, because in hospitals we actually keep them quite regulated. I think there is a much bigger illicit market in other countries. The slang term for it is special K, and I've read and you see stories about kids mixing it into fizzy drink bottles and taking them to parties, and then they get a high. That's really dangerous, because now we're using an anesthetic drug to get a high in a completely unregulated environment. We're a low resource country, and the majority of people are not going to have the money to be able to afford to buy ketamine. There are much cheaper illicit drugs on the market.
So there are many of these cowboy clinics who advertise ketamine for all sorts of uses, for treating migraines, anxiety, ADHD. How do you control that, and what can we do about it?
So the question I would ask is, what's the evidence? And if I'm told, well, how are we going to get the evidence if we don't try it? Absolutely. But we don't try it in individual practices, and we certainly don't try it in South Africa in the private sector. Let's put it through a randomized controlled trial. Let's get SAPRA to approve the trial, and then let's create the evidence. Because if we're not practicing evidence-based medicine, we're not practicing safely.
Coming up, what South Africa's medicines regulator says about ketamine. Welcome back. Is ketamine a tool of hope or a slippery slope? Some say it's changed their lives.
6 years ago, Lene Leroux was halfway through her psychiatry training and had just had a baby when depression drained the color from her world.
I remember once going to a music show with my husband and friends, and I just remember crying during the music show because I was so excited that we were going out, we were going to be outdoors, we were listening to a band I love, and it just felt like nothing.
She knew the signs of depression.
You know that it's a medical condition, and you learn the symptoms and you learn the signs and you learn how to diagnose it and what the treatment is. But when you experience it yourself, it is very different. And so for me, it didn't look like somebody crying all day, every day, and you don't see it, you know, like someone else who's got a diabetes or high blood pressure that are struggling and needing to take medication for that. It feels like you've failed. You become more withdrawn, you just isolate more and more. So when you learn this at university, it's called anhedonia, and you just lose interest and you lose joy and enjoyment in things in life. I was hospitalized at the time with postpartum depression.
Her psychiatrist prescribed ketamine, not commonly used for mental health at the time.
Textbooks, but not something we get much exposure to during our training. So it was actually the first time that I'd really delved into it was when I was having the treatment myself. So I wasn't even aware that there were such rapid-acting antidepressants, really. I received a few intravenous treatments while I was in hospital, but I got better quickly and I was able to be discharged and continue treatment as an outpatient.
The experience changed her path. She began training in how to give ketamine safely.
The type of infusion that we use now, according to sort of the SASOP guidelines, is intravenous infusion. With the intramuscular, it is a lot more rapid. So I think if you're not feeling very safe in that situation, it can be very, very anxiety-provoking. The intravenous sessions, for me personally, I didn't feel much of a clinical effect or a dissociative effect during the sessions. For me, that was a lot about life and death, and it was a lot about sort of past traumas and being in a state where I am a little bit dissociated. I was able to think through those things without panicking and without feeling anxious and without being overwhelmed by the kind of bodily experience and emotion. And so for me, that was a very, very helpful form of treatment.
Lene has set up a practice with other GPs who have psychiatric training. An emergency doctor manages drips and monitors vitals.
We do intravenous treatments according to the SASOP guidelines, and a lot of patients still do have very strong dissociative experiences on that, which for some people is distressing, for others it's really helpful in terms of what they're processing. And so we try and tailor that a little bit for the patients. But like I say, that's not for everybody, and it doesn't mean it's not working. You don't need to have dissociation or psychedelic effects from ketamine for it to work for the depression. So if it is a very anxious patient or an elderly patient or someone that's frail, we'll do a really, really slow, gentle infusion.
It's about restoring patients' hope, but only for what evidence backs up.
Ketamine-assisted psychotherapy as a separate entity is not in the SASOP guidelines or supported at the moment just because there's not enough evidence yet, and that's not what we do here. But we do try and offer a little bit of support, whereas a lot of centres don't have somebody that's trained in mental health sitting with the patient for that hour.
So what are doctors legally allowed to tell their patients about ketamine, and what can they say on their websites? Dr. Boitumelo Semeti Mokokotlela is the CEO of South Africa's medicines regulator, SAHPRA. Tumi, thanks for joining us. What is ketamine registered for in South Africa?
So in South Africa, SAHPRA has registered ketamine for 2 indications. The first is for its use as an anesthetic compound when used with other products. And we've got 2 products of that nature registered. And then the second indication is for treatment-resistant depression. And there's a product that's been registered since 2022 for that. The product that is registered for treatment of treatment-resistant depression is in a nasal spray.
So does that mean it's used off-label?
You have instances where, based on other prior use, based on published studies that manufacturers may not have necessarily provided to the regulator, the healthcare practitioners are aware of that data and would then utilize the product off-label. It is an informed decision because they would base it on clinical evidence that's published even in other countries, etc. But what that means is that if anything happens to the patient, they then cannot go to the manufacturer who makes that product but had registered it for a different indication.
So there is increasing use of ketamine for the treatment of depression in South Africa. What's the way forward to make it safe?
If they want to use the current dosage form for infusion, which is registered for anesthetic applications, if they want to make sure that it is included in the label, we would need to receive the data as a regulator. As you rightly say, we are seeing more and more use of ketamine for treatment-resistant depression. I anticipate that we will start to see more applications, but it's a request we're putting out there that if those could be submitted and we would evaluate.
Tumi, we've gone online and we've seen many clinics advertising for ketamine and for all sorts of things, you know, not just depression, ADHD, migraines. What is SAHPRA's role?
We would really like to urge the healthcare professionals to make sure that they comply with the Act. Products that you will see advertised on television, etc., it's typically Schedule 0 or Schedule 1 products, because we understand the risk that comes with then the higher scheduled product. So we're not saying you can't communicate, but you certainly can't advertise and you cannot market. Because this is a Schedule 5 product, again, it becomes ever more important that the use and the prescription thereof is managed, because again, scheduling takes into account the risk to a patient.
Just to clarify for our viewers, what does a Schedule 5 product mean? What are the rules for that?
If it's a Schedule 5, you cannot go to a pharmacy and say, I would like to have a product of ketamine because I've been diagnosed with depression, or I think I've got depression and I want to use that product. You won't be able to get that. You need to be assessed by a healthcare practitioner who then would provide a prescription for you to receive the medication.
So for the use of infusions for ketamine, we would need an application by a pharmaceutical company for it to get registered, right? It's not doctors who can come to you and say, please, can you register it?
Yes, no, it's not a doctor. It will have to be a pharmaceutical company.
Tumi, thanks very much for your time and insights.
Thank you very much, Mia. And this is a fantastic show, and we hope that we'll be able to get more feedback for us as SAPRA on this matter.
That's our show for this month. Follow us on social media and send us your story ideas at health@bekasisa.org.